PHM organized 2 tracks of activities. One was focused on trade and health, and the other on extractive industries and health. The first session was on how current trade agreements impact our health. The next one was on ISDS and if that's a public health threat. And then the final session was on what would a healthy trade agreement look like. And it involved role play activities and letting people use the information and tools that they had learned in the other sessions to act out what lobbying against current trade agreements would look like and how we could make a healthier trade agreement. So the extractive industry sessions started off with a session on hydrocarbons and health. So we discussed fracking and other hydrocarbon extractivism and how that impacts our health around the globe. From there, we had a session today on using health as a mobilizing tool against extractive projects. And we had representatives from Texas to northern Canada to Brazil and Ecuador in the Amazon, and people really discussed how these extractive projects all over the globe are related and interconnected, and how using a health angle can be really strong to combat them. Finally, we had a session on workers and environmental health, and how we can sort of bridge the traditional divide between labor and environmental concerns, and how they can actually work together using a health angle, and that many of those concerns are not actually opposite but are the same. I think the overall goal of PHM here at the World Social Forum was to have people understand how they can use health arguments as a tool in their mobilizing across various issues. So I think that the health angle is really something that people don't always think of if they're not directly involved in public health work. And so our goal was to get people thinking about that and thinking about how it could add to their campaigns and their advocacy work and learn more about it.